All right, so we're going to be talking about pain. Your approach, what you think about how you deal with patients with pain. Go ahead, Doc.
Pain is a real pain. I'm sitting here talking to Mr. Frank Holland, who's had pain for 20 years, and he knows what a real pain is. Pain is a good thing acutely. That is, it tells us there's something wrong and needs to be attended. For example, if you step on a tack, you need to know that there's something in your toe and the pain will call your attention to it and you take the tack out. On the other hand, once you know there's nothing bad wrong, pain could be devastating. It's very important to look for the cause of the pain, and sometimes we just can't determine. The most common problem that we see is musculoskeletal pain, of which there's numerous triggers, many things that could alleviate it, but there's nothing like a magic to do that. When we identify where the pain is, what kind of pain it is, hopefully we could refer that patient to an individual such as a chiropractor if it's a pinched nerve, or if it's something like due to shingles, an infectious disease specialist, although nowadays most doctors know to treat it with a drug like acyclovir. But then there are some pains that has a very poor determination of why. And when the doctor can't find out what causes the pain, he ends up calling it fibromyalgia. Fibromyalgia, and this I believe is what one of the diagnoses you had, Frank, where folks have pain all over. They wake up with it, they go to bed with it. Sometimes it gets a wee bit better depending on the weather, but most times it gets worse. Most times when they have other issues with stress, it gets worse. And then the poor doctor and the poor patient is left to cope for themselves. We sometimes use systemic relief of the pain, things to modify the neurotransmitters. Many doctors these days do neurotransmitters to determine if there's an excess or decrease of certain neurotransmitters that may or may not make the pain worse. Drugs we use to modify the pain, like amitriptyline, which is used to help people sleep as anti-anxiety and an antidepressive, sometimes does decrease the pain by 20 to 40%. In some cases, like migraine, even 100%. And then we know that the nerves carry the pain, particularly the small C fibers, and drugs may work, but also minerals such as magnesium. The drugs that work when doctors aren't quite sure are the anticonvulsants. Neurontin, or the son of Neurontin, Neurontin's gabapentin, and preGABA, the son of Neurontin, Lyrica, works to help that. Testosterone also mitigates the pain, and we frequently use that. We know folks that have low vitamin D have more pain, particularly muscular pain. If we use vitamin D, it helps the pain adjunctively. If all else fails, we resort to narcotics. But narcotics, like many of these other things we talked about, are just band-aids. We try to go very, very slow, go very low, but most times, narcotics being what they are, the dose is escalated over the course of years. And folks like Frank, who has been on narcotics for 20 years, when I met him was taking an inordinate dose, and we've had a couple heart-to-heart talks, and he convinced me that his pain was real. Of course, I knew it was, but I had to be convinced again, because every time in this state that we write a narcotic, they make a little check in our name in Oklahoma City, and if you have too many of these checks on too many patients, they think the doctor is having a big sale on pain medicines, and they're just out there to make money rather than helping patients. The most recent thing I've learned about pain is a resurfacing of an old technique called FSM, fibrospecific microcurrent. And I'm going to talk to Mr. Holland today on FSM. FSM,
Frequency specific.
frequency-specific microcurrent. Dr. Abrams, back in the 1920s, started doing a lot of research on small doses of electricity, so small that one cannot feel it. But it goes through the body, rejuvenates the cells, goes through scar tissue, turns on the right neurotransmitters, turns off the wrong transmitters, and pain can go away. This, unlike a TENS unit where they feel, masking the pain, like white noise if somebody has ringing in the ears, this really does relieve pain. It heals tissue. And again, Frank, we're going to talk about this today.
Fantastic, thank you. Doctor, quick question. What are the things, natural things that we can do to mitigate pain? I know you mentioned sleep. Better sleep can help.
A good night's sleep, yes.
Okay.
Niacinamide.
Niacinamide, okay.
Niacinamide is an excellent pain reliever. Arnica montana helps trauma and pain related to the trauma.
Okay.
There are some alkaloids, such as found in belladonna, scopolamine. They may help pain.
Okay. Thank you so much, Doc.